Hello, my name is Madeline Wyburd. I'm a current DPhil student in the Ultrasound Neuroimage Analysis Group at the University of Oxford. I'm going to be presenting mine, Mark Jenkinson and Anna Namburete's work, which is using CNNs to segment the cortical plate from developing three-dimensional ultrasound volumes. The fetal brain begins to develop 13 days after conception. And one of the most striking changes is the transformation of a cortical surface, which goes from a smooth to a heavily folded surface under a process known as gyrification. Gyrification is found to be temporally consistent across the healthy population, with set landmarks appearing at set times. So here in pink and white, I've illustrated a Sylvian fissure, which forms around 14 weeks gestational age and continues to vary until about 2 years old. Here we can see it getting wider and deeper across these 6 weeks. Variations in gyrification have been found with fetuses who are at risk or diseased. So on the left-hand side, a group compared the variation between preterm newborns and age-matched fetuses, and they found that preterm newborns had advanced gyrification compared to their age-matched controls. The opposite was found with fetuses with congenital heart disease, and they were found to have a significantly decreased surface area across gestational age compared to healthy controls, implying their surface was less folded. Therefore, given that it's temporally consistent, gyrification is temporally consistent across the healthy population, and variations are seen in disease and at-risk pregnancies, it's a really important metric to study in utero. So studying gyrification is commonly done by first segmenting the cortical plate from image modalities. So this can be done manually, except for it's extremely time consuming and requires expert knowledge of the cortex. So to try and save some of this time, the most common method is atlas-based label propagation, where you align your volumes to an age-matched atlas, usually the same gestational week. You then manually segment that atlas and then propagate the labels back into your registered volumes using the same transformations used to align them to the atlas. So this works reasonably well, except for it normally requires manual corrections afterwards. It's also reasonably time consuming, as you have to register your volumes to an atlas. You also have to perform labeling onto the atlas, which, like I said, is time consuming and requires a lot of knowledge. And lastly, you need an atlas which is the same gestational age range which you're looking at and in the same imaging modality, which isn't always available. So in more recent work, authors have been using CNNs to segment the cortex from fetal volumes. So this is done in earlier this year, and they trained a network to segment the cortex, as we can see in red. And this works reasonably well. However, all these methods I've described so far have been exclusive to MRI and have not been performed in ultrasound, which is the method of choice and used commonly throughout pregnancies. It's also a lot cheaper, available worldwide, and much less time consuming than MRI. So having methods to study gyrification from ultrasound volumes would be of huge importance to monitor pregnancies. However, having said this, ultrasound volumes are extremely challenging to work with due to the speckle and acoustic shadowing found throughout. So here's one volume from our dataset, and you can see the cortical plate just here following that arrow, but it's really hard to work out and the edges aren't very well defined compared to MRI volumes, making it a much more difficult task. So in our work, we aimed to design a CNN method to segment the challenging cortical plate from ultrasound volumes. We then want to evaluate its performance. Like I said, this hasn't been done in ultrasound volumes before, so there's no gold standard way of segmenting it, so we have to find a new way to compare. And then we go on to analyze the cortex from ultrasound volumes. So I'm going to briefly talk about our network design. So multitask learning has commonly been used in CNNs. It's quite a simple idea. You have one input and then you use one network to output multiple tasks. So it works by simultaneously optimizing the performance of all tasks in training and reduces task-specific noise. So this is commonly used to solve multiple problems within one network, such as brain segmentation, classification, and localization. So you get 3 outputs from a network. However, more recently, it's also been used to regularize your network. So you introduce an auxiliary task, which output you don't care about too much at your final evaluation stage, but you use it to help aid the training of the other task which you're interested in. And this is what we're interested throughout this work. So we propose a multitask learning where we have our input of our three-dimensional ultrasound volume, our main task output as a binary classification task of cortex or non-cortex, and then we introduce this auxiliary regression task to regularize our network, where it predicts the distance from each voxel to the closest part of the cortical plate. And we chose this task as depth is extremely important to cortical plate anyway, and across gestational age this depth will vary so much, but we thought by forcing it to learn depth information, it would aid the segmentation of the challenging cortical plate structure. So that was our MNet. We then compared it to baseline networks. Our first, just a simple UNet design where we give it an input of our three-dimensional ultrasound and ask it to segment the binary classification task of our cortex. And then we also compare it to a regression network where we ask it to predict the distance map from the cortical plate to the outside, to the rest of the volume, which is our auxiliary task for our MNet. And we'll refer to that as DT-UNet. So this is our main network setup for our MNet. So we have a single encoder, which joins onto two decoders at the bottleneck. Each encoder-decoder branch acts as a modified three-dimensional UNet, where they're concatenated together each layer, and the number of features doubles between each layer, and the size halves. And there's our two task outputs. So that's our MNet. Our UNet is just a single encoder-decoder producing the segmentation at the end. And our DT-UNet is again just the second decoder stream producing the distance map, which we can then threshold to get the cortex segmentation. I'm now going to briefly talk about our experimental design. So we're lucky enough to have access to the Intergrowth 21st dataset, which we used ages between 18 and 22 weeks gestational age, and we have 307 three-dimensional fetal brain volumes. All the volumes were aligned and resampled before we got them, and they had a voxel size of 0.6 millimeters cubed. So in order to do our training, we needed labels for the cortical plate across our training and testing data set. And as I said, this is an extremely time-consuming task to do by yourself. So we use atlas-based label propagation. From the dataset we're using in previous work, an atlas had been produced. So we had the transformations needed to get from each individual to the atlas. So we manually segmented the cortex on the atlas between 18 and 22 weeks, and then propagated those labels back to each individual by using the inverse of the transformations used to produce the atlas. In ultrasound volumes, the hemisphere furthest away from the probe is the only one visible due to acoustic shadowing. So across the work, we'll only be looking at one side of the cortex for each volume. We wanted an even distribution of hemisphere side and also each age range between our testing and training set. So we separated them out this way, as you can see from this bar plot, where it's evenly distributed between the side and ages. For each network design, we trained for 200 epochs, a learning rate of 10 to the -4, and due to memory constraints, a batch size of 3. We then applied 5-fold cross-validation, where we separated the training set into 5 sections and trained the model 5 times using a different validation set across each one. We used dice loss as our segmentation and L1 as our distance regression task for the 2 baseline networks. For our MNet, we used a combination of these two, so for our main task and our auxiliary task, and we looked at the performance when we varied these weightings across epochs. So we started out where it was just consistent, where the weighting alpha was just 0.5, so it depended evenly on both our auxiliary and main task. And then we looked at increasing it across epochs. So starting the task, focusing on our regression auxiliary task, and then by the end of training, more heavily weighted on our segmentation task. So we did that with alpha step and log alpha. So these are some of our performance across 3 out of 5 folds. So this is our ground truths and then performance across each network. So one of the most striking things to observe here is the DT UNet is blank for 2 out of the 3 here, and actually 3 out of the 5 in total. And this was due to the fact that we threshold the regression task to get the cortex, but on 3 out of the 5 k-folds, it just wasn't learning depth well enough. So thresholding it just produced nothing because it was predicting distances which were way off the correct value, which suggests the task was too difficult for this simple network. Across some of the other data sets, we can see large holes in the masks, in the cortex labels, which don't correspond to a high dice loss, but can cause topology errors when looking at the cortical surface. So they're really needed to be avoided. The average performance across these 5 methods were then looked at using dice and binding cross entropy, and we found that UNet had superior results, which isn't too surprising as their labels best matched our ground truths. The DT UNet has this really high standard deviation, which again isn't too surprising, seeing as it wasn't learning across 3 out of 5 folds. And our MNet performs less well than UNet, but reasonably similar. And we think this is due to the fact that the regression task was too difficult for the network to handle. So in our MNet, it learned to ignore this task, which essentially made it into just a single encoder-decoder network, producing a UNet-like design, and hence why it's getting similar results. I'm now going to talk briefly about our analysis. So as the UNet performed best across the 5 folds, we then retrained it using all the training volumes and evaluated it on 36 unseen test set volumes, and we found to have a high DICE score of 81% and a binding cross entropy of 0.09. As I said previously, there's no gold standard method for ultrasound cortex segmentation, so we designed our own. Sylvian fissure depth has a well-established protocol and has been studied extensively over the last few years. So we measured the Sylvian fissure depth from our segmentations and then compared it to the known literature. So we tried this 2 ways. We started off trying to do an automatic measurement. However, this was too challenging due to the fact of finding the right plane to look at within the volumes. So instead we did it manually following the protocol described in the literature. We then compared it to some work performed in 2017 and found a high correspondence between the depths across our gestational age and their found depths. There's some outliers, which we think is due to difficulty again in finding the correct ultrasound plane, and also the skull boundary isn't very well defined, which makes it quite a challenging task to know where that depth ends. We then wanted to look at where the network was failing, so we propagated all our test set volumes for each gestational age back into a reference space and then averaged over them to see where the network was confident. Unsurprisingly, the network was confident in the center of the cortex labels and has high uncertainty around the outside. This isn't too surprising, as the boundaries in ultrasound images are really hard to define, and when I was manually labeling the atlases, it was quite challenging to know where it began and where it finished. There's also regions here where it's failed to predict well, and we think this is due to the fact that we're averaging over quite small groups, which is shown along the bottom, with only 2 weeks used for the right-hand side of 22-week atlas. So it's really dependent on variability between data sets, and if a data set has intensity modulations across the volume, it then makes it really difficult to predict where these boundaries are. We then went on to look at the depth measurements across our averaged atlas surfaces by measuring the distance from the skull to our surface. Between this age range, the most striking change that is known is the increased depth in Sylvian fissure, which we see across our volumes here. Over the weeks, the Sylvian fissure gets much deeper and wider, as well as the volume increasing, which is what we expect to see across this age range. So in conclusion, we've been able to show it's possible to segment the developing cortex from ultrasound volumes, which to our knowledge has not been performed before. And we found that although multitask learning has been found to improve performance across similar tasks, but for our task, the modified UNet worked the best. So thank you for listening, and please feel free to email me any questions or comments to this email address. And thank you to all my affiliations.